This is a known case of carcinoma of thyroid, right lobe. First, I will show you its extent, the metastasis. This is a lymphoid mass here. The purpose of showing you this carcinoma of right lobe of thyroid is what to see, how to see, and what to comment and how to comment, and how to mention its exact extent, involvement of different structures, etc. Now, this is the basic mass lesion which involves right lobe of thyroid. Now, this is the right common carotid artery. It is completely surrounded by the mass here. You see. Now, this is the left common carotid artery. This is left internal jugular vein. Both of these are patent here. On this side, the internal jugular vein is completely occluded by the mass. The artery is a relatively, it's a rigid, thicker walls. So usually their occlusion is quite late as compared to the venous structures. Now, if we trace it downwards, this is the common carotid artery here. The mass has also surrounded the terminal part of the subclavian artery. And this is the brachiocephalic trunk of right side. Now the mass abuts trachea. It has displaced trachea towards left side. It has indented the right lateral wall of trachea, and apparently it appears that its interface with the trachea is indistinct. This is esophagus here. Esophageal lumen is fairly preserved, and its interface also appears fairly distinct. So it appears that there is no involvement of the esophagus. Now, if we go superiorly, its interface, this is the submandibular gland here. This is the submandibular gland here. The mass has involved the right submandibular gland as well. If we proceed upwards, this in fact is a lymphoid mass here. This one, which is a metastatic mass. This metastatic mass, this extends upwards. This is the parotid gland. This extends into the parotid glands. Normally the lymph nodes are also present in the parotid gland, whether inflammatory or they may enlarge in inflammatory conditions as well as in the metastatic disease process. This, for instance, is another metastatic lymph node here, level 2, and similar lymph nodes are present in the level 5, posterior to the sternocleidomastoid muscle, in the posterior triangle. Now the sternocleidomastoid muscle is infiltrated. On this side, this is the sternocleidomastoid muscle. On right side, you cannot make out the sternocleidomastoid muscle. So the mass is a malignant mass. There is no intralaryngeal extension. We must very clearly see and mention that there is no involvement of the larynx. These are the piriform fossae. There is no involvement of the hypopharynx. This lymphoid mass extends into the parapharyngeal space here in the level of the. Now these are the valleculae. This is the epiglottis, base of the epiglottis here. So this lymphoid mass extends into the right parapharyngeal space. It has compressed the adjacent blood vessels, but doesn't. It partly encases the internal carotid artery, but generally it is spared. So inferiorly, the mass extends downwards posterior to the medial end of the clavicle. So there is a extension of the mass into right supraclavicular fossa as well as retroclavicular extension into the upper part of the thorax here, up to this level here. Now there is another mass which lies apparently separate. It lies anterior to this medial end of the clavicle. It is partly cystic, its posterior part is solid. Now superiorly, this is continuous with the above described mass. This most probably is a metastatic mass here, and it lies in contact with the sternum here. Apparently there is no erosion of the clavicle or the first costal cartilage. But if you change the window, these are the sclerotic metastases here in the manubrium sterni here. In fact, the chest of this patient has also been scanned